Here we are for Radiology Rapid Review Part 3. So the way this is going to work, similar to the other parts, I'm going to present you with 3 different cases, give you about 30 seconds to review the images. Feel free to pause anytime you want during the video, and then we'll go over it. Image 1 of 1. Okay, so here we have a non-contrast CT of the brain, and one of the first things you want to rule out is an intracranial hemorrhage. And over here, as you can see, there's no evidence for intracranial hemorrhage. The next thing that you want to do is you want to make sure that the gray-white differentiation is maintained. What does that mean? That means that you look at the gray matter, which is right here at the cortex, and that should be hyperdense when you relate it to the adjacent white matter. White matter usually has myelin sheath tracks, and those are usually fat attenuating, and because of that reason they're hypoattenuating when you compare that to the gray matter. Now, whenever we have loss of the gray-white differentiation, that usually suggests that there might be some element of cytotoxic edema, and cytotoxic edema suggests to us that it might be ischemia. So if you take a look here, you'll see nice gray-white differentiation, but then when you reach this area here in the left parietal lobe, we see blurring of the gray-white differentiation, and we have essentially loss of the gray-white differentiation. This is a left parietal stroke, and this is usually MCA territory, and we have a stroke right here in the left parietal lobe. And our clue for that is the loss of gray-white differentiation. All right, next case, image 1 of 2. Image 2 of 2. Okay, so here we have an ultrasound of the ovaries, and one of the first things that you're going to notice is that there is asymmetry between the ovaries. That's your first clue. The ovaries should be symmetric. We also measure volumes. They not only have an asymmetric shape, but they also have asymmetric volumes. The left ovary is actually larger than the right ovary, so we have asymmetric enlargement of the left ovary. Also, we notice this component here. This looks like a hypoechoic component, so this is some inflammatory change as well as some edema of the left ovary. That makes us highly suspicious for ovarian torsion. Anytime you have asymmetry between the ovaries, one of the first thoughts that go through your head should be torsion. So looking at the second image, this gives us our confirmation. We have, as you can see here, color Doppler flow on this left ovary, and we have loss of arterial and venous flow. This was a case of left-sided ovarian torsion. All right, so final case, image 1 of 2. Image 2 of 2. Okay, so here we have a contrast-enhanced CT of the abdomen pelvis, and this slice in particular is looking at the pelvis. If we look in the right lower quadrant, we see a thickened appendix measuring about 1.2 centimeters. Around the appendix, we see all this hazy inflammatory periappendiceal fat stranding as well as periappendiceal fluid. Now, anytime we have an acute appendicitis, there's some important questions that we need to answer, Is there any free intraperitoneal air? In this case, we do not see that. Is there any drainable fluid collections? Although we see all this fluid, we do not see any component that has a rim-enhancing region to suggest that there's some kind of an abscess. However, I must say that if you see this much periappendiceal fat stranding as well as this much fluid, you have to question, has there been a perforation? Is this a perforated appendicitis? So further investigation was done via an ultrasound, and what we happen to see here is we see a tubular structure in the right lower quadrant representing the appendix. We see that it is significantly thickened. I don't have the image here, but it was hyperemic. We see a lot of echogenicities in this region, suggestive of fat stranding, and then we have all this complex fluid here in the right lower quadrant. This turned out to be a ruptured appendicitis. So there you have it. Hope you enjoyed. Like and subscribe. Let me know in the comments below if you like this rapid radiology review. I hope you guys are learning something, and until next time.